you? Welcome to my YouTube channel. I am really delighted to have you. As you have realized, this week I've been doing a series on gynecological conditions, and today I want to talk about something we refer to as endometriosis, a diagnosis that causes a lot of pain to women who have it, but luckily we have medications that can be given to help relieve some of the symptoms. Now, what is endometriosis? As a woman, you have a womb. Let's assume this is the womb of a woman, okay? Your uterus. So inside your uterus, there's a lining, what we refer to as the endometrium. Now, in endometriosis, what happens? This normal inner lining of the uterus is found in other places where it's not supposed to be found, in other ectopic sites. And normally what happens as a woman, you have ovaries. Let's assume these are the ovaries. They're going to release hormones, and these hormones normally have an effect on your endometrium, which is the inner lining of your uterus, all right? Now, what happens when you have this inner lining in other parts of the body? When the hormones are produced, they act on endometrium tissue, whether in the uterus or in other parts, okay? So this tissue also undergoes changes, proliferation, and there is shading of the tissue in form of blood. Now, that is endometriosis. How will endometriosis present? A woman with endometriosis in 70% of cases experience a lot of pain during their menses, what we refer to as dysmenorrhea. This pain normally starts way before the periods or your menses, and then reaches the climax during your menses. Unfortunately, goes on even after your menses have resolved, takes a few more days before resolution. And this is so because you have that cyclic, that periodic growth, shading of your endometrium in whatever areas that it is because of production of ovarian hormones, and also because this endometrium tissue produces certain substances that actually cause you a lot of pain, what we refer to as the prostaglandins, examples being the prostaglandins F2 alpha thromboxanes. The second thing is that such people tend to have excessive bleeding, excessive heavy menses. It's something none of us as women wants to have. And the third thing is most women with endometriosis have actually had to struggle with fertility issues. And then the fourth thing, women with endometriosis sometimes experience a lot of pain during sex, what we refer to as dyspareunia. In any relationship, intimate relationship, I think one of the cornerstones to maintaining that relationship is actually good sex. But when you get this constant pain, as a woman, I'm not sure you will be getting into the mood to get involved in the act because of the fear of pain. And the last thing is women with endometriosis tend to have this chronic pelvic pain. This chronic pain on your lower abdomen, chronic pain at your back, whose cause you might not know until you go to a doctor, and after taking quite a detailed history, it's realized that you're actually struggling with endometriosis. There's no specific factor that has been shown to actually cause endometriosis. There have been various theories that have been given. Some research has shown the role of genetics, with first-degree relatives actually being at a higher risk of getting endometriosis. Other researchers have talked about the environmental contribution and many other scientific reasonings behind the occurrence of endometriosis. How endometriosis is diagnosed? Through your history. And then number two, we have imaging that can be done. We have something we refer to as laparoscopy, which is actually the gold standard in diagnosing endometriosis. Management is, there's no specific drug that has been found to cure endometriosis, but things can be done. For instance, if you're struggling with fertility because of endometriosis, to increase your chances or to relieve your pain. So management could either be expectant, could be medical, could be surgical. Expectant management could be done in, let's say, people who have very mild endometriosis, or those who are almost getting to menopause, okay? And then we have medical drugs that can be given. You can be given what we refer to as non-steroidal anti-inflammatory drugs. They reduce inflammation and they also help to relieve pain. A common example in the market is ibuprofen. We also have one which we refer to as mefenamic acid. Besides that, there's a role for combined oral contraceptive pills. This is because they prevent that continuous growth of the endometrium in other ectopic sites, cause what we refer to as endometrial atrophy. We have various groups of drugs. We have drugs in a group we refer to as gonadotropin releasing hormones that can also be given. And then we have the role of surgical management through laparoscopy. So if you're a woman and you're struggling with these things, mostly you get that excessive pain during periods, starts before climaxes and takes time to resolve after your periods have stopped. You have pain during sex, you're struggling to conceive. And the other thing is you have this excessive bleeding and this chronic abdominal pain whose cause you don't know. That could as well be endometriosis. Thank you so much. And this September, we are still going to do a series of many gynecological conditions. And may God bless you. If you've not subscribed to this channel, please remember to do so. Thank you.